Look, listen, don't go. I'll be brief. I'll get to the point. This is something very important. So violence in healthcare is one of the most catastrophic and dangerous things that has been happening in recent times to healthcare. Aside from a global pandemic, this might be the new pandemic, but not jumping down those paths. Just looking at the numbers. Right now, I have some notes. So right now, approximately 2.3 million ED visits, 376,500 hospitalizations, more than $8 billion in healthcare cost annually. These numbers are annual based off of 2017 data. We know that things have gotten much more since 2017. While there's no one solution, I believe that one of the primary foundation bedrock solutions for violence prevention is education. Healthcare Safety and Violence Prevention, HSVP, has created that education. This program will save organizations money. You ask how? So the average education cost $307,876 per organization. This is when you calculate their time paid off of the unit in a training classroom. So HSVP cuts that cost to $134,338. That is tremendous. That is more than half. But according to AHA, HSVP can save each organization $347,257 a year just in training cost. This doesn't count the secondary and tertiary cost. Let's look at those. On the secondary and tertiary cost, this is looking at absenteeism, turnover, injuries. This equates to roughly $600,000 a year per organization in savings. If every organization partnered with HSVP, not only could we save lives, we could save $1,128 million in healthcare spending across the US. If you act now, between now and Christmas, so this is a Christmas savings. If you can act now, I'll take an extra $15 off per student. And you might ask why? Why am I taking so much money off? Why am I reducing the cost so much that we're now a third of the cost of any other company? Because I'm passionate about this. I'm not concerned about the money as much as I'm concerned about saving our healthcare workers, reducing the anguish, reducing the strain and the stress and the PTSD and the trauma that associates with violence in healthcare. I'm a nurse. I've seen nurses. I've seen other employees. I've had an employee put in ICU after a patient beat them. I've been teaching this globally as an advisor for the past 5 years. This is my passion. Not only am I board certified psychiatric nurse, I'm a global advisor, educator, and faculty advisor for the DoD. This program is separate from that, but I carry all that knowledge with me to bring to you at a very low cost. Contact us, hsvporganization@gmail.com. Visit our website, visit us on Teachable.